when we think about this construct that we're going to make, we need to think about what are the things that are going to make it stable, what are the things that are going to contribute to it being stiff, because it's an emergency situation. You're putting your fixator. At the moment, we're not actually too worried about how much callus is going to be formed. What we're doing is just trying to keep it rigid for all the reasons that Anand talked about this morning, that to relieve pain and to stop any further soft tissue trauma. So what are the things that we're going to be thinking about in order to give ourselves a more rigid construct? Rad, you want to
Yes, yes. So principle of external fixation, so near, far, far.
Okay, near, far, far. Does everybody understand what that means? So you're going to have, say there's a fracture across here. You don't want to be in the injury zone, but you want to be outside of the injury zone and have one near and one far from the fracture on either side. Okay, so that's going to help with stability. Katie, can you think of anything else?
Well, just focusing on monolateral, so I can't say multiple bars. But if you keep the bar close to the...
Multiple bars, well, yes you can. Multiple external bars in different planes, that will certainly help with the construct stability. Nick?
Pin size.
Pin size.
So wider diameter, pin size greater.
Okay. And how is pin diameter related to the stiffness of the pin?
Diameter of the pin in relation to the diameter of the bone.
Right. Okay. But if I have a 5mm, if I have a 2mm,
increase diameter, increase stiffness.
So I have a 2mm pin, and I'll try to bend it. It'll have a certain stiffness.
Yeah.
If I have a 4mm pin, how much stiffer is it going to be than the 2mm pin?
Four times
to the power of 4. To the power of 4, so it'll be 16 times as stiff. Okay. So that's pin size.
I think the bar closer to the limb.
So your external bar, the closer it is to the bone, right, the stiffer it's going to be. Okay, very good. Who's next? Arun.
At least two pins, basically.
Yes. So you need to have 2 pins
side.
on each side. If you've only got 1 pin on one side of the fracture, you're going to have an unstable construct. Okay. What about 3 pins? Is that better than 2?
3 gives you more stability, but 4 is not going to be good.
Right. 4 doesn't actually give you any more stability than 3. And if you're going to put a third one in, you don't really want it to be in the same plane. A different plane would be good. Okay, that's very good. Who's next?
You can use a larger diameter rod externally.
Yes, absolutely. So that's an 11mm rod, so that will be stiffer. And again, the stiffness is to the 4th power of the radius. So a larger rod will give you a stiffer construct.
Can I just interrupt about the pin? Do you mind if I...
No, of course.
The 3-pin thing, it's very important, is that if you have 2 pins in the same plane, they can bend. If you put a 3rd pin, even 10 degrees different to that, it suddenly acts like a tripod instead of them bending, it's a push-pull situation. So you only... Yeah, thanks. My engineers have worked this out, because we're thinking of putting a 3rd pin slightly out of line on our IOS fixators, and you only need 10 degrees to give you about twice as much stiffness by adding that 3rd pin. So if you can put, and practically with this sort of situation, if you have 2 pins one side of the bar and 1 pin the other side of the bar, that gives you enough of an angle to get a big advantage from having that 3rd pin. So it's worth thinking about that.
James?
Pin bone interface.
Pin bone interface. So what's important about that?
Even a good fix between bone and pin.
Good fix. And how are you going to get that good fix?
We mentioned in the earlier lecture about pre-drilling.
Pre-drilling, yeah, because often you see people using these, but unfortunately, with all the best will in the world, you can't actually keep the axis central, so you end up doing that, and you end up destroying the proximal cortex. And the proximal cortex is where you're going to be getting most of the stiffness comes from the proximal cortex, but you have to grip the far cortex as well. Okay, so pre-drilling. Next, James.
The amount of interfaces you have in your construct.
Yeah.
So you want to keep them as few as you can, because the more interfaces you have, the more chance you risk of destabilising the frame.
Okay, when you say interfaces, you mean between links?
Yeah.
Okay, so the links are always going to be the weak point in any construct, especially when you use carbon rods. Carbon rods, obviously, they're great because they're not visible on X-rays, but at the same time, the interface between your stainless steel and your carbon rod allows a little bit of laxity. Okay, that's great. Nick?
Ensuring you stick to the safe zones.
Yeah.
When you're using your sort of too near, too far, to make sure that you're avoiding any important structures.
Okay, but we were talking about stiffness and stability. Right? Is there anything else that you can think of? There's one really important one. Right.
The rod close to the bone.
What, close to the bone? Yeah, going through the far cortex. Yes, that's important. Have we said going how far the rod is from the bone yet? Someone said that already. Okay. There's something that Prof mentioned in his lecture about something that took away the amount of strain. Amount of strain off the fixator. What else?
The reduction.
The reduction. So having an anatomical reduction will actually give you the best. That's the most important factor in stability with an external fixator. Okay. And I think we've talked about the number of pins. We've talked about how thick the pins are, the reduction, spread of the pins, orientation. We talked about the third pin. The bar, thickness of the external bar. One more thing about the external bar. We talked about the thickness of one bar. More bars. Yeah. Right. So if you have 2 bars, then it makes it stiffer. And if you're going to have 2 bars, it's stiffer. If they're close together, they're less stiff than if you have them further apart. So it just creates a box-like structure which is stiffer. Okay. So I think that's basically all of the factors. Now, what are the other advantages of pre-drilling apart from the fact that you're not going to destroy that near cortex? What else is the advantage of pre-drilling?
Prevent fracture.
Sorry?
Prevent fracture.
Yeah, it prevents fracture. But if you pre-drill with a smaller drill than the size of the pin, you're actually radially loading the bone as well, which again contributes towards the stiffness. Okay.
Can I mention something else? If you pre-drill it, you're likely to have less heating because you always use a sharp drill, always use a new drill for every case. There's various, there are various little clues. If you're, the first thing is drill one cortex. Come out with the drill still running, so you bring the swarf out with it. Don't stop and then kind of reverse it because you push the swarf in. So you have it running. The way that, if you watch CNC lathes, the drills run at a constant speed and they control the rate of cut by how fast they advance it. So you always have the drill running full speed and then you control how fast you advance by how hard you push. Don't slow the drill down because then it'll start to heat up. The best engineering thing is to have the drill running as fast as you can. So you have the drill running fast, advance it slowly, come out with it still running, then you get the scrub nurse to wipe, you have a very wet swab with saline on, that gets the swarf off it and it cools the drill. And then you do the second cortex and do the same thing. And then you wash it out to get any swarf out because those are little sequestra if you leave them in there. And then you put your screw in, because a self-tapping screw, if you put it in, and especially if you put it, heaven forbid, on power, it heats up like fury because it's doing a lot of work. The self-tapping end is cutting and doing work and it heats up. So the depth of the thread is only about 1 mil or so. So if you destroy 1 mil of bone around the surface of that hole, that thread will just fail and the pin will drop out. So it's crucial to keep things cool. And if the drill starts to squeak, it means it's getting too hot. Come out quickly. If you smell smoke, of course. So always try and keep it cool, and pre-drilling is the way to make a cool hole.
Now, that's one thing I really learned from Prof was that washing out the wound with 20 mils of saline, and you'd be amazed at just how much swarf appears out of the hole, and that was just sitting underneath the surface of the skin, waiting to get infected.